Okay, all right. Look, the details are contained in a report by the Ghana Statistical Services. It's the 2022 Demographic and Health Survey. Okay, and I think it's the page on nutrition that has this rather startling statistic I'm about to share, which is that amongst the population that was surveyed, here we are. Among the population surveyed, it was determined that among women ages 20 to 49, only 5% of them are considered to be thin. A whopping 50% are overweight or obese.
Mm-hmm.
Only 5% are thin. Okay, now this compares to the statistic for men that says among the same age bracket, 20 to 49, 6% are thin and 21% only are considered overweight or obese. So the weight is certainly skewed on the feminine side. We want to know why, and we want to fix it. To help us with that, let's say good morning to Dr. Yaw Osafo. He needs no introduction. He's the Drive Doctor. He's a specialist in clinical biochemistry. He joins us over the phone. We also have Emmanuella, I hope I'm saying this name right, Yayra Saku, who is a registered dietitian. Emmanuella, please correct me if I got the name wrong. Good morning to you. Do we have Emmanuella on Zoom? We're working on it. We will connect to Emmanuella shortly. But I believe we have Dr. Yaw Osafo.
Good morning, Kojo.
Good morning to you, and Nafishaba.
This year I haven't seen you.
It's true. It's true. The whole year. We must do something about it. Anyway, we're so glad you could join us.
Good morning, Winston. Winston is there, right?
Yes, and Mama V. Yes.
And good morning, Mama V. Good morning, Accra. Good morning, Ghana.
Good morning, Doc.
Well, Doc, maybe we'll start by, getting some basic definitions under our belt. First of all, being overweight is not the same as being obese, is it? What's the difference?
No, they are not the same thing. But before we start, Mama V, let me ask you to do me a very huge favor. You are very familiar with the tape measure. I mean, the women are always taking measurements for the seamstress.
Mm-hmm.
Please, I need to get some measurements for the 3 musketeers you have with you in the studio.
Oh.
Yes, please take their abdominal circumferences for me.
Yes, Doc, I will. Great assignment.
Right.
She'll be invading privacy in the process.
Let's look to get some definitions under our belt. Most of the time, as a doctor, I hear people use obesity and overweight interchangeably. Well, they are similar concepts, but they are not exactly the same. We can look at it as the different conditions on the same spectrum or a continuum. So you move from having a normal weight to being overweight and then to being obese. Typically, we would use something we call the body mass index, the BMI, which I'm sure a lot of our listeners and viewers are very familiar with. It is a ratio that relates your weight to your height. There is a specific formula for it, but then that's really what it is. We're trying to relate your weight to your height. And because when we do this, we will get a number. That number is what tells us that you're carrying a normal a BMI, or you are overweight, or you are obese. So when that number falls between 18 and 25, we would say the person has a normal weight. When that number falls between 25 and 30, then we would say you are overweight. Or to be more specific, 25.1 to 29.9. I don't want to bring in the decimals to confuse that, but just 25 to 30, if you are in that age, if you are in that range, then we will classify you as overweight. Once you hit 30 and you cross 30, then we will say you are obese. In the obesity rank, because we still have grades. So we introduce grade 1 obesity, grade 2, and then grade 3.
Okay.
Depending on how far away you are from the number 30. So between 30 and 34, we'll say you are grade 1. Between 35 and 39, grade 2. When your BMI hits 40 and above, and you're watching some, that is obesity grade 3. But that's not the end of it. We realize that for better clinical risk assessment, we need to also add another parameter, which we call the abdominal circumference. Amabi, I hope my task, you are near completion. I need Winston's first.
All tape measures are currently occupied in Kokumlimli.
I'm being threatened. Somebody is threatening to sue.
They are all being used for important national development.
So the important parameter we add to the BMI to help us better risk assess our patients is something called the abdominal circumference or the waist circumference. The reference point here is the belly button. So whilst you are relaxed, standing upright, and not breathing in to deliberately cheat the examination, which I am very sure Raymond will be doing exactly that, taking a deep breath to tuck in. But when you are absolutely relaxed and standing upright, use the normal tape measure. So all our listeners, I want you to check it right now. By the end of the show, you can send it in, and then we'll know what your readings are. We measure it in inches. So that tape measure has an inches side and has a centimeter side. If your abdominal circumference measured the way I have described it, if you are a male, adult male, and that circumference hits 40 inches,
Okay.
then we would say the individual has abdominal obesity or truncal obesity. The trunk is that midsection of your body. So we say you have truncal obesity. If you are female, then we reduce it 35. If you are 35 and above, then we will say you have abdominal obesity or truncal obesity. We will add these two, the abdominal circumference measurement with the BMI measurement, and then get a very good clinical risk assessment. What is the risk to your health? So, Kojo,
That's
this is by way
interesting.
of definition.
That's very, very enlightening. Very
And
enlightening,
what
Doc.
overweight is.
Doc, let me ask you. I mean, I understand why, for men especially, you would use this truncal obesity, index to determine, by measuring their stomachs. But for
it goes
women,
to both men and women.
yeah. But I'm asking about
But
women.
we have different numbers.
Why would the trunk be the same body part that you use to measure women's obesity? Why not a bit lower, like buttockical obesity?
Could you want to be fair? So we know that when it gets to the midsection, there are no differences in terms of the anatomy. It is pretty much standard. When you look at a girl and a boy in that area, there are no differences. But then if you look at other parts of the anatomy, then there are natural differences.
So is that to
so
say?
we can't flatten out the comparison there. So it's best we do it that way.
Is that to say that the fat that is stored in sort of the buttock area of women is not threatening to their health?
Right. So there's a very important point that we brought up. What's the difference between the abdominal circumference and then the BMI? Because the body mass index, you start on a scale and we measure your entire weight. So that is fat in your legs, fat in your thighs, fat in your hips, in your buttock, in your arms, everywhere, plus muscle, bone, and all of that. And then we relate it to your height. But we also realize that in terms of specific risk assessment, for example, when we talk about cardiovascular risk, things like strokes, heart attacks, and the rest, then we need a surrogate for something we call visceral fat. The amount of fat around your abdominal organs. We have realized scientifically and medically that correlates closely with your risk of developing adverse cardiovascular events like a stroke, like a heart attack. So that is why the BMI is okay, but then you need the abdominal circumference because it is a good surrogate for assessing the amount of fat that male or female we have around our important abdominal organs. These have close correlations with your risk of developing cardiovascular disease. But when it comes to other health risk, for example, risk of arthritis, then your overall weight is important, not just the one around your midsection. So if you carry a lot of weight in your buttocks, a lot of weight in your hips and thighs, you're going to develop arthritis of the knee very, very early. And then you're going to have mobility challenges, for example. So although we use the umbrella term risk to health, when we doctors are assessing patients, we look at individual health risk. So we look at cardiovascular health risk separately from, for example, mental health risk associated with weight.
Right. Thanks for that breakdown. I believe we have Emmanuella Yayra Saku on the line as well. Now, Emmanuella is a registered dietitian. Hi, Emmanuella. Thanks for making the time.
If I can briefly chip in before Yayra comes in, so I set the stage for her.
Sure.
Because I wanted to briefly talk about the causes of obesity.
Okay.
Because most of the time, when we hear about obesity and overweight, the first thing we think about is that the person is eating too much. But I want us to know that there are 5 major categories in terms of the causation. So when we see someone is overweight or obese, we shouldn't conclude that it is dietary. And Yaya is going to talk about the dietary causes of overweight and obesity. So I want to briefly mention the other 4.
Right.
The first one is something we call drug-induced obesity. Yes, we are the culprit. We, the doctors, the prescribers of medicine. Sometimes in our attempt to do good, we'll give you some side effects with some of our drugs.
Right.
So I will have a patient I'm treating for epilepsy, and I put the person on some anti-epileptic medication. It will give the person a side effect of carrying too much weight. I'm treating a patient with depression. Some of the medicines we use for depression can let you put on. You're treating a patient for a number of conditions for which we use, like asthma, for which we use steroids. And the person can put on too much weight as a result of that. So there are a number of medicines that have that particular side effect of getting you to put on too much. So drug-induced obesity is number 1. Number 2, there's a portion of the brain. We call it the hypothalamus. Yes, big word. But pardon me. It's a part of the brain. It's in the higher center of the brain. Sometimes some disease conditions or even trauma from a road traffic accident, and you bang your head terribly, have a severe head injury, and that part of the brain gets traumatized, then it is very, very possible that you develop obesity because that part of the brain is now dysfunctional. So we have those causations as well. Then we have what we call reduced energy expenditure. And here I bring out the differences between men and women. There are 3 forms of reduced energy expenditure. The first and most common one is what Raymond Atta is guilty of, lack of exercise. And then they are all guilty. lack of exercise. Regular exercise, not the weekend warriors. Those who come and climb the PDR, they only on 30 and then there's some mutual joint up there. When they get there, then they condemn everything they've done with the mutual. Anyway, so that is reduced energy expenditure in the form of reduced physical activity. And it goes with age. So when you look at your statistics, you realize that as men and women grew older, then the risk of the incidence of obesity and then overweight, went higher as well.
Yeah.
Well, yes. When we are growing older, well, you get a job, you save some money, you buy a car, or you call an Uber everywhere you go. You don't walk as much. You don't play football again with the boys in the area and so on and so forth, because now you are quote unquote respectable big man or big woman. So that's number one. The next point that brings out the differences between men and women is something we call reduced resting energy expenditure. But when we are at rest, doing nothing, lying on the sofa, reading a book, your body is functioning, so you are burning some calories from things like breathing, from movement of your intestine, heartbeat, functions of the kidney, and so on and so forth. All those things go on. So on the average, we burn between 1,300 and 1,700 kilocalories every day. But as we grow older, this resting energy expenditure drops significantly. They, again, look at your data from the Ghana Demographic Health Survey. You would see that as men and women grew older, then they started putting on a lot more weight. The last one is genetic. And some people, they have some genetic factors that make them put on a lot of weight. They are born that way and they have a big problem. These are the 4 different categories in terms of causes. The 5th one is dietary. And I think I will pass it on to the registered dietitian at this point.
Perfect. And I've just measured my truncal obesity with Mama B. It was 39.
Honestly?
40. I saw 40.
It was 39. What was the space there for?
It's not 40.
I did the measurement. 40, doc.
Yes.
Hey!
Me too, I saw 40.
This is a propaganda measurement.
Mama B, thank you very much for the very honest report. Yes, I know they want to.
God is my
They
witness.
want to doctor the report, but we can't doctor it.
Mama B is leaving some space I don't understand though. You should take a hand. Anyway.
How about Raymond?
No, Raymond is not. Raymond is
Doc,
certainly not within the tolerance.
Raymond is 42, doc.
42.
So, do you really believe that the difference between me and Raymond is only 2 inches?
I'm surprised. I think Raymond should be around 45.
Oh, the evidence is there.
Or maybe I should be less than 40. Anyway, Emmanuella Yayra Saku, I believe, has now joined us via Zoom. Emmanuella, good morning to you and thank you for your time. If you can unmute your microphone. There you go. Can you hear us?
Yes, I can hear you.
Wonderful. We're so glad you can join us. And as Dr. Osafo laid the foundation, one of the causal factors of obesity is poor diet. And
Yes.
we're glad you're here to help us with that. I mean, look, it would appear that almost any Ghanaian food is known by its carbohydrate. Talk to us about how dietary choices in this part of the world are contributing to this 50% of women between 20 and 40 being either overweight or obese.
Thank you. So thank you, Kojiro, for having me. And then good morning to your listeners as well. It's a scary statistic which we don't have to overlook. We definitely have to do something about it. So like Doc was saying, dietary factors are one of the major causes of overweight and obesity. As part of my practice, or what dietitians do is we ask for a diet history. So usually when you see a dietitian, the dietitian will want to know what your food intake is like. And I've observed a certain trend. I'm sure my colleague dietitians will attest that there's a certain trend in our food intake, especially with the age group which has the most prevalent incidence of obesity and then overweight. So one of the things that I have observed is that there is an increase rate of the intake of processed foods. So with our diets and then lifestyle here in Ghana, probably I'm sure elsewhere it is, but because we are looking at the demographic and health survey for Ghana, I'll narrow it down to what I have observed in practice. We do a lot of processed foods. The issue with these foods is that most of them come with high calories. And high calories, I mean the energy that the food gives you is very high. And then Doc mentioned one of the causes of overweight and obesity being an increased rate of physical inactivity. If you are eating a lot of energy and then you are not extending it, you are going to be gaining weight. So if you are doing foods high in fats and sugars, and we are not exercising to burn out the calories you are getting from these foods, then of course we would have a lot of incidence of overweight and obesity. Again, another dietary cause of overweight and obesity is drinking too much sugary drinks. So I'm sure you would agree with me that when you go on our market, we have a lot of sugar sweetened beverages available. Both children and then adults alike, we are drinking a lot of them. We are not saying these drinks are bad, but then when we are not putting caution to how much we are drinking, then of course we are going to be getting a lot of calories from these drinks, because sugar is a carbohydrate. You mentioned carbohydrate. Sugar is a carbohydrate. Carbohydrate gives us a good amount of calories. So if you are drinking a lot of these drinks, then you are getting a lot of calories, which we may not be burning through physical activity, and so you'd get overweight or obese. Then again, we also have people eating large portions of meals. So Doc usually says when he goes to his, he comes on drive time on Wednesday evenings, he says you look at people's bowl of fufu and you are wondering, is it one person's meal or it's two people's meal? You would be surprised to know that a very large bowl of meal is for one person. If you are eating a large portion of food, then the likelihood that you are getting a lot of calories from that food is high. If you don't burn it out, you would gain weight. So these are some of the basic dietary things I have observed in practice. Another one that we usually don't pay attention to, but is a major cause of obesity, is drinking too much of alcoholic drinks. So yes, please. That's why we don't want us to talk about alcohol, but I'll talk about
please
it
talk about it. Talk about
it. So alcoholic drinks would usually come with some sweetening, and these sweetenings would give us some amount of calories. So while you are drinking your alcoholic drink, you should have at the back of your mind that you are getting some calories from that drink. So, but basically if you ask somebody, what have you eaten today? The person will mention their main meals. I ate banku, I ate kinky, I ate rice, but will forget to tell you that I drank 3 bottles of some kind of alcoholic drink. That drink you took gave you some calories, which you have to consider as an energy source. So if you don't know that your alcoholic drinks are giving you calories, today we are emphasizing on it. Anytime you are drinking alcohol, remember that it is giving you energy, and you have to work out or exercise to burn that energy you got from the alcoholic drink.
Yeah.
One day, yes, please.
We'll come back to you because I think you've raised a couple of questions for us. But I am aware that we will lose Dr. Osafo in just a few minutes because he has another appointment. So if you don't mind, let me quickly touch base with you, Doc, on a couple of things. The first one is this: the statistical survey revealed that women are clearly, in large numbers, more obese and overweight than men. What accounts for that in particular? I mean, especially bearing in mind, one of the things we've learned from you in previous conversations is that women have better health-seeking habits than men. Why are they more obese than men?
Right. There are a number of factors that contribute to this particular finding. I think number one, there's this sociocultural influence, strong influence from our culture and from our society. There was some time back where I heard some report, very credible report, from a part of the country where particular medicines that were restricted were only medicines you should get with a doctor's prescription were being procured from certain pharmacies, from community pharmacies, without prescription. And it was an increasing trend. So someone paid attention to it. All the individuals buying this particular drug were women. It turned out that they knew that the drug had a particular side effect, which because of our sociocultural orientation and definition of a beautiful woman, being one who is proportionally sized in different parts of the anatomy, this drug lets you accumulate fat in your buttocks, in your arms, and then sometimes in your face. And because of our sociocultural orientation and definition of a beautiful woman, and what the men's alleged preferences are, I don't know whether at this point I can put Raymond on the spot about what his preferences are in terms of the physical appearance of a woman, but
yes, you may.
Generally accepted that Ghanaian men like, as they say, a woman of substance. So I think that's a very strong influence to the point that women would go out there to go and buy a drug that is very dangerous. I don't want to mention the name of the drug because I want to discourage that particular thing. But it's a very dangerous drug. But people are buying it because it will give them big behind. So for me, that sociocultural influence is very, very important, and we need to drop it. Yes, we can all have our preferences that, yes, we don't want a thin size 6 or size 8 bony, like thin overbone type of person. Every individual will have yes, but when that pressure is there that before we can define a woman as beautiful, she must have a very huge behind, huge thighs or hips, that strongly pushes them to also take some of these measures. And these are very, very unhealthy. Number two, women, again, because of another important sociocultural factor, I don't know why, but maybe Mama B, I'll put you on the spot. I have realized a lot of women don't engage in any physical activity the moment they leave secondary school. That's it for them. They become ladies, aristocratic ladies. They don't have to run. They don't have to get dirty. Nothing. They don't have to sweat, except they are out in the sun. So for me, that's a big, 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 big myth. The guys, I see them go play football. So if you come to Preset after Friday evenings and all that, they'll drink their beer and then play the football. Try and knock it out. But I never see women out like engaging in some physical activity. I think again it is because of the way we perceive an Arab to be. That kind of definition. So maybe Mama V, you weigh in when I'm done on that particular point. Thirdly, I spoke about the reduced resting energy expenditure. When you compare men and women, then women above 40, they tend to drop their resting energy expenditure. That is when they are laying down, doing nothing, not exercising, not working. The amount of energy your body burns, both men and women will drop there, but the rate of drop is higher in the female sex than in the male sex. That is something that we don't know exactly what the biochemistry or the genetics are yet. But that's one observation that we have made. Lastly, when it comes to food choices, I think the women generally go with the sugary things. So we also say, oh, we're a mansa. A mansa means that it's some sweetened drink. So they'll go for the malts, they'll go for the Fanta, they'll go for the Coke. Then when Kojo comes to visit me and we meet somewhere, I'm not giving him any of those things. I go and bring out the Jack Daniel, and then we sit and then we will pour something, because culturally that's what we have accepted to be. But these calorie dense drinks, these sugary drinks, you classify them as calorie dense. They pack a lot of calories. Lastly, when it is Valentine's Day, the men who will buy the women's things, what do we buy them? You buy them chocolate. The sweetened things, the calorie dense product. So again, when it comes to food choices, I think they go for the more calorie dense foods rather than the men, and this may account for some of the differences. But then the resting energy metabolism and the relatively low physical activity are big factors.
Yeah. Now, Doc, being overweight or obese is actually quite dangerous, isn't it? We downplay it a lot. But what are some of the direct ways in which it puts us at risk, our lives at risk?
Right. So, Kojo, this is a very silent epidemic, and it will reach pandemic proportions soon. We know what is talking about it. We accept it. It's good to be nice and plump. Everybody keeps asking me why I'm the same weight as I was back in 2006 when I started working. Why I'm so thin, and so on and so forth. But being overweight and being obese has direct health risks. Now, could you listen to this? Obesity has the same impact on life expectancy as smoking.
Whoa.
Yeah.
Whoa.
The impact of obesity on life expectancy is as someone who smokes. So when it comes to the development of type 2 diabetes, when it comes to the development of hypertension, when it comes to the development of strokes, when it comes to the development of a condition we call PCOS, where a woman becomes infertile and a woman begins to start looking like a man. When it comes to high blood cholesterol, when it comes to risk of developing certain cancers, breast cancer, colon cancer, ovarian cancer, they are all associated with overweight and obesity. Arthritis, which affects your mobility. So now you can't walk, you can't exercise, and a sedentary lifestyle then also poses all of these risks. So this is like somebody stealing from you and smiling at your face. So you find this person, very friendly and nice, but then the hand is gently going to your pocket and taking your money away. Yeah. That is how I see obesity and overweight. We all downplay. If you have there's somebody was like, oh doctor, maminya kasikakana mi plan to mana metunya chitebu yi. Whoa. You know, yeah, well, they want to put on the traditional cloth and look good in it. We will praise a woman for doing a good job because you are taking good care of your husband. It means you put on. So for me, my wife, she never gets applauded because I am just 68 kilos, as thin as you know what, and then so she never gets applauded for a good job done. But that wife who is making you gain all that weight is killing you. So, Kojo, the risks are enormous and they affect every system in the body. It even affects your mental health.
Yeah.
Because it's great depression for a lot of people.
Indeed.
So let us not take overweight and obesity lightly at all.
Yeah.
They are very, very, very big medical conditions, and the responsibility for doing something about it starts at the national level, governmental policy, deliberate.
Yeah.
But then why is it that people come up the mountain to walk? It is because when they were doing that route, they created a safe pedestrian walkway.
Yeah.
That is why people are able to come up and jog and walk up and down a total of 4 kilometers going up and 4 kilometers coming down, 8 kilometers.
Yeah.
But name me any other route in this country where you can have that. It doesn't exist. So that's why deliberate governmental policy. Where are our parks?
Yeah.
Although you've lived in London, you are very familiar with the UK. Oh, every 10-mile radius, every area has a nice, decent park.
Yep. Green spaces.
Where you can just go, walk about, play a game of football, something. Where are our neighborhood parks? So that's where at the national level, that's where it has to start.
Yeah.
Then at the societal level, to our social group, when we meet all the time, we are doing some party, we bring food, and then we eat, we play music. But can we meet at a preset actual theft? These days, there are a lot of actual thefts dotted around. And as your social groups, whether it's church, school, association, you should meet there and then exercise for fun.
Yeah.
Then at the individual level, we should all take responsibility for our health. I keep saying this. I, as a physician, I cannot be more interested in your health than you, the individual. My job is to assist you. My job is not to be interested in your health more than you yourself.
Yeah.
So these are some of the measures that we need to take regarding it. Everybody can do something about their weight.
Yeah.
Because there are even surgical interventions at the end of the day. That is a very extreme form. But there are simple measures which I'm sure Yayra will talk about.
Yes.
That we can also all start taking.
Let's come to our dietitian, Emmanuella Yayra Saku. Raymond, you had a question for her, didn't you?
Yes, she mentioned clearly that alcohol is a contributing factor to the amount of energy and calories that we consume. But does it depend on the alcohol, for example? Beer's more infused with a lot more carbohydrates and energy than, say, whiskey. That's a question that somebody asked me to clarify with her.
Yeah, so Winston, the calories that the alcoholic drink is giving us is what we are concerned about. So most often you'd have the beers having more calories than the spirits and then the wines. But the basic thing is, if you are taking, say, 100 mils of beer, the amount of calories you get from there would be lesser compared to if you are taking 500 mils of wine.
Okay.
So the quantity you are taking in relation to how much calories that drink is giving you is where the focus should be. But then I had a question for you too. Do you know your calorie requirements, or do you know how much calories your body needs? That is my question.
No, mostly it's when you feel hungry that you eat. So when you feel hungry, you consume, let's say, 2 balls of banku or fufu. And if you're Maxwell Baba, you do 4 or 6. It depends on the range that's available. And of course, if it's 2 scoops of rice, then you add some salad to it with the hope that it balances up the amount of calories that you are consuming within the period. Yeah.
The impact of this question is that a lot of us don't know that our bodies even have a certain amount of calories that it needs.
Okay.
So if you are eating beyond your calorie requirements and you are not burning that excess calorie, that's where the weight gain begins to come in. So I would entreat us that we need to know our calorie requirements. And to be able to know this, you need to approach a nutrition expert. So it's part of our training to be able to determine a person's calorie requirements. And we can also tell you the amount of food to eat that would help you meet this calorie requirement or stay within the calorie requirement. So this is something we have to take note of. I encourage everybody, visit your dietitian. Let them assess you, let them help you know your calorie needs so that we can help curb this epidemic of obesity that is staring at us.
The problem with you and your friends is that some of course, these are wonderful proposals, right? Oh, you have to eat right, you have to cut back on this and that. But why should I sacrifice eating fufu entirely so that I'll look in a way that's preferable or good for my health? I mean, can't there be a balance between the two? Can't there be a midway that I'll still be able to eat fufu and yet still be healthy?
Yes. So it's not very obvious. You hardly get someone saying stop eating this entirely, because as part of practice we believe that eating should be pleasurable. So unless that food is like very detrimental to your health, you would not get a dietitian just going like stop eating this, stop eating that. No. So we are looking at your total calorie needs, and then we give you suggestions. If it is fufu, this is how much it would help you meet. If it's banku, this is it. If it's rice, this is it. So you choose whatever you want to eat. But because you know the end game, you are eating within the requirements to meet your needs.
I have a question here from a listener for Dr. Osafo. He says, please ask, does giving birth automatically make a woman overweight? In fact, I'll add one more, Doc, so you can answer them both together. We've got just 2 minutes to go. This one also says, I'm aware certain family planning methods cause an increase in weight. Is there anything we can do about this weight gain to stop?
Right. So, the first question is yes. That's the short answer. That having babies or becoming pregnant, going through a 9 month would cause a woman to put on some weight. Of course, depending on what happens during the pregnancy, the weight gain can be variable or is variable in women. Some women don't even want to walk because they are pregnant. But Serena Williams was playing professional tennis, I believe, for the first 4 months of her pregnancy or so. So we encourage exercises during pregnancy. You are definitely going to put on. We always say that we are looking at around a 10 kilogram weight gain during the entire pregnancy. On the average, the baby comes out, most babies weigh between 3.0 and 3.5 kilos. The placenta too will give you some weight, and then there's the fluid around the baby. So if you look at that difference, it's all with the mother. And that's the time you have to work it off. But then what do we see? Culturally, we ply the woman, the new mother, with a lot of food. If you go and see the farm nut soup with their abedro in there, they say, oh, she should eat a lot so that she produces breast milk. It has no correlation. There are hormonal influences that play for the breast milk production. So a lot of that happens, and you don't shed off all the weight after the first pregnancy. Then you get pregnant again. Then the second one, you add on to it. You have a foundation, you add on to it. By the time you are through with your third child, you have put on a lot of weight. So that's what happens.
Interesting.
The birth control methods, yes, there are a lot of the hormonal-based methods will cause weight gain. So again, a thorough assessment will be done before you choose a family planning method. You need to see a doctor and speak with your doctor or the midwife. We need a thorough evaluation, and then we'll give you alternatives if we think that your risk for obesity and overweight are high.
Thank you so much. In fact, I have to say a big thank you to both of our guests. Emmanuella and Dr. Osafo, for your very insightful contributions this morning. We've learned so much from you both, and we appreciate your time with us. This conversation,
Thanks for having me, Kojo.
Indeed.
Bye-bye, Mama V and Raymond.
Yeah, we have to come back to this,
Yes,
no doubt. There's so much more to learn. And there was a text message from Julie in Malam who wanted us to help her calculate her BMI. Her weight was 78.5 kilograms and her height was 156 centimeters. Raymond has done the calculation for you. You are 32.3, which means you are obese.
Class 1.
Yes. There you go. So now you know what to do about it. This was an interesting text from Judas. His name is Judas. Mm-hmm. Okay. He says, I'm a gym instructor and I see it to be our indisciplined way of eating and a lack of bodily exercise until we see our body size falling. You mean changing, perhaps? And then he makes a point. He says, majority of ladies I train just want to shape in their hips, their bums, their thighs, their tummy, and other parts of the body, not to actually be healthy or lose weight. Interesting contribution there from Judas.